And we're now up to the, I think, final session, which is a reflection by the Scientific Steering Committee. I'm very happy that we had that committee looking over our shoulders, trying to get this project done. Very knowledgeable people from from different disciplines were in this scientific steering committee. They were part of the project and provided advice on several occasions. And members of the scientific committee are Professor Heleenn, for instance, from Australia, or Ulrich Hegerl, you know of, and seen earlier on Professor Marion Laboyer from France, Professor Jan Smit, also part of the scientific steering committee, methodological issues, and Professor Christian Kidholm from, for instance, more of an economic perspective. The commission has been chaired by Heleenn Riepe, my professor, I would say, a professor of e-mental health at the Vrije Universiteit Amsterdam, VU University, and I've been very lucky to be working and being provided with the opportunity of and the trust in engaging in this endeavor of implementation science in e-mental health. So very thankful for that. And Heleenn is working not only at the VU as a professor, but also at in Geest, large mental health service organization, Amsterdam, you know of, but also honorary professor at psychiatry at the University of Southern Denmark, and visiting professor at the University of Turku in Finland. So welcome to you, Heleenn. I'm also going to present the other two members of the Scientific Steering Committee who are part of this session, who is David Ebert. I need to switch to another screen there. Professor Ebert, David, for me, well known also in the field of mental health, e-mental health research, done loads of work there. And now is professor of psychology in digital mental health care at the TU Munich, the Technical University in Munich. But also, and I find that very interesting, founder and chief scientific officer of Hello Better, that's formerly known as Get On. So really not only doing high-level research, but also applying that in a real-world setting in this specific spin-off located in Berlin. Impressive work there. And I'd like to also welcome Professor Ulrich Hegerl, who you obviously already have known and talked to earlier this day and throughout. So welcome, Heleenn, David, and Ulrich, and thanks very much already for your feedback. Over to you, Heleenn.
Yeah, I'm unmuted. Okay, thank you so much, Christian, and welcome to the audience, and also to two of our very special scientific advisory board members, David and Ulrich. I hope I may use your first name for within this discussion. We know each other, so it sounds a bit artificial. David, you still congratulations for your newly obtained position as professor at the UT of Munich. Very well deserved, very happy. But before we start with some reflections of the Scientific Advisory Board, as chair of the board, I would like to compliment the whole team of Implemental. I think many words have been said already over the last 2 days, but I think it has such an amazing achievement within this domain, because it's a domain, the science of implementation and its applicability in routine practice is still in its infancy, both from a scientific manner, but also from a methodological member. So you really have given birth to something very beautiful and important with this project. Especially, I would like to thank the project coordinator, Dr. Kim Mathiesen, and formerly Klaus Pedersen, Mr. Klaus Pedersen, who was the project coordinator. You have done a great job. The same holds for the scientific coordinator, Christian Vis. I don't think I have to add anything on that by now. But also to all the project leaders, ranging from Christian to Anna Etzemüller for the implementation as usual, WP for Tracy and Tim for the theoretical background of normalization theory, Josien Schuurmans and Claire van Genuchten and Adriaan Hogendoorn, who have done a great job in the design of the study. Also the European Alliance Against Depression was one of the WP leaders. And I also would like specifically thank Gamian, which have the European Patient Representatives Organization. I think you have done a great job with being so proactively involved in this. And I think Kim has done so, and this is my last remark. I would like specifically pay tribute to Jeroen Ruwaert, who unfortunately passed away 2 years ago, but he has contributed to a high degree to the method of this project with the step wedge design and all the analytic procedures that come within it. So thanks a lot. We also think that this reflection is also to celebrate this project. Now, Christian said already that we have had a very wise scientific advisory board. But to be honest, I think the advisory board has learned a lot from all the members of this project as well, especially myself, given the multidisciplinary approach with more theoretical scientists like Tracy and Tim involved, the qualitative methods on top of the more quantitative statistical methods, all the routine care partners which are involved, the continually strive for a conceptual development of what is all about. So thank you also from that perspective from my part, and also on behalf of the other science board members. What I would like to do now is to start with a question for Ulrich and David. And I actually want to ask you, what are the two most important lessons you have learned from this project, both from a success perspective, but also from a failure perspective? And I don't mean that negative, but I think we can learn not only from the successes, but also from failures. And it's a goal, open goal, Ulrich, but I remember that you are one of the board members who had some concerns about the method we have applied for this project, given the high influence of contextual factors and the importance of process within such a complicated project. May I ask you to give your first reflection, and then you to David? And I have also heard that members of the audience can ask a question or react on one of the reflections of the board members, and then Heleenn will help me with. You can raise your hand, and then Ansley will give you the floor. So Ulrich, the floor is yours for now.
First, I want to join your congratulations. This is the first I want to say. I think it's been a wonderful project, and if you ask me what is the biggest achievement, I would say it has been the learning we have all done together, this collaboration. Everybody has now learned about implementation, and I myself and the younger people are going to use this knowledge and this expertise in the future. In the next coming 10, 20, 30 years, if they stay in the field where they are now. So this will have long-lasting effects. But this comes immediately to the problem, how to evaluate this. You cannot evaluate this. You would need a 20-year project. You cannot use a special randomization design. So coming back to what you mentioned about some thoughts about methodology in general, I think when you start such a complex intervention, I think it should be important in the future for us and for others who are going to start such interventions to think very carefully what is the effect size you can really expect by the intervention. And in generally, it's good to be modest here because one tends to overestimate what you really can achieve and to put it in a balance with all the which comes in. And this variance starting point, some countries already have been active, others not. These are circumstantial factors, legislation, such things. These are intervening factors during the process, which you cannot foresee, unforeseeable events such as COVID and other elements. And the question then is, can you really control this by randomization? For example, in drug therapy, you need about 200 patients you randomize in order to control more or less all these factors, this heterogeneity in the people involved, and then you see a significant difference. Here,
okay, Ulrich, sorry, may I? Because we want to have some interaction. I think you have addressed a very important point also about was the randomization the most appropriate approach given the small number of organizations we actually involve?
Randomizations, yeah. There should be a good balance between these two. Okay, I can stop here if other points perhaps later.
Yeah. David, may I ask you for a first reaction?
Yeah, very interesting question. I think the biggest success for me is like really bringing the different disciplines together and trying, like what we did with the project, trying to combine more the social sciences, the organizational aspects of implementation, and also more qualitative mixed method research with more the clinical intervention research methodology, and bringing that together and to totally different disciplines, and then always bring these two perspectives together, which is really can be really exhausting because people need to first learn to understand each other before you can come to any like consensus or whatever. So that's a very intensive process, and I think for me, I was not in the day-to-day operational like business, but I think that's what's like the core challenge or one of the core challenges of the project. And for me personally, also like one of the but most exciting things about the project, because I really think that that by working together and leaving your own perspective, so that's the way to move forward in a lot of different areas of life, but especially when we now think about like how we can bring implementation forward, I think we can learn a lot from that.
Yeah, and what could you perceive as a successful failure, so to say? What have we learned? What we think that we could do that better the next time?
Yeah, I think coming back to Ulrich's point, like the confounding factors. So like implementation, like the biggest confounding factors, like you can't control for, like legislation changes, for example, and that is like, and you can plan that in advance, like so you can't control for such factors. And I'm not really sure what to learn out of that right now. But that's when thinking about going into the future, that is something that we need to address when we try to continue this type of work.
Okay, I would like to open it to the audience this point before I go over to the next issue. Adrian, I see you as our famous statistician. Can you reflect a bit? Have we been able to deal with this confounding or the role of the contextual factors?
Yeah, well, thank you. Yeah, obviously there's a lot of things going on while taking a course of all these months, years almost, in following what happens. Still, I believe, as was laid out before I entered this program, I think the design was quite well chosen in taking a stepped wedge design. Obviously, you only have 12, something like that, number of organizations, but still in following the normalization at the staff was, I think this design was optimal. And of course, there's always things happening from all kinds of corners, but that's inevitable. So I think the design is being a clustered randomized design. So I think it's quite well done. So yeah, that's about my comments.
May I tease you a bit and maybe ask that the other the science advisory board members or other people in the audience would be the next step from a methodological perspective, go into the area of a much more adaptive design so that we could take into account more the contextual developments like COVID, for example, or would that jeopardize, because I know there have been loads of discussion about it, jeopardize the end results in your perspective because they are then biased on a different level?
Yeah, I'm not that familiar with these adaptive designs yet, so I cannot comment on that. Sorry.
Okay, that's a pity. I would like to thank you, Adriaan. I would like to ask the second question to David and Ulrich, and that is about, do you think the implementation of digital mental health is implementation stuff as usual, or are there very specific elements which we need to take into account? And I also saw Tim on the audience. I first would like to have the reaction of Ulrich and David, and then maybe of Tim if he's still on board, because he is also the implementation specialist in other domains than digital mental health. I just want to ask your first reaction, please. Ulrich, you are still muted. Ulrich, you are muted. Yeah.
Well, it's better to stay muted. I have not a good answer to this question. I think this is very different for every implementation. There are, of course, peculiarities, legislation boundaries, and treatment guidelines, and things like that. But if you make implementation in other areas, you have similar factors involved.
Thank you, David. Do you want to react? And then Tim?
Yeah, it's a difficult question. I'm not an implementation science expert, but I have lots of experience with the implementing digital mental health interventions. So and with whatever you implement, you need to take into account like the barriers of the facilitators of all relevant stakeholders. So that's something general, so which is probably relevant everywhere. So, but when I think like about what I've seen in digital mental health implementation projects or where it has been tried, that at many occasions we failed to really take these barriers into account and design our implementation strategies to overcome these barriers, that we do not understand sufficiently like the needs of the different stakeholders. And I hope that more here implementation science experts come into the field of digital mental health implementation, because I think we can learn a lot from that.
Okay, yeah, we have a couple on board, like Tim and Tracy and Stefan, and some of our own young research team members are now. Tim, do you want to react on this?
Yeah, I mean, I don't think there is anything specific about e-mental health. I really don't. I think, well, let's think about it in different ways. If you look at all the systematic reviews of determinants, barriers and facilitators, they're roughly the same, whether you look at e-mental health or mental health or whatever it is. We get variation on the same thing, because what's really key is we're talking about systems. We're talking about complex systems. So we get people factors, and it doesn't matter which framework you use, if it's micro, meso, macro, or people factors and system factors, whatever, we still get the same thing. The question is, what's the capacity to be able to leverage change? And what are the levers you can pull as an organization or as an individual or other kind of things? If we look at the kind of lots of work that's gone on around e-mental health prior to this point, it's been about, there's less system stuff, but more about how do we engage patients in different ways, less organizational stuff. So I think there's been less focus on the organization and the implementers and the implementation work. But I think the jury's out about if there's anything that specific. But on the other hand, I think what's really interesting, each site has had its own specific issues that it's had to focus on. That's the tension here. So there isn't, so really, it depends. I mean, but that's a terrible answer. But I do think it's the same issues irrespective of what we're talking about, but it's the degree of the capacity to change some of these things that I think is potentially at stake here.
Okay, thank you. If we have 2 or 3 more minutes time, it's a perfect bridge to my last question, because of course this project is finished, but the work not, and it has become a little bit my own mantra. But after having followed this project for a long time and contributed to it in other manners, I'm a little bit tired of barriers and facilitators. So how can we bring now implementation science, or the work we are doing, can we bring it beyond barriers and facilitators, or do you, Ulrich and David and maybe others in the audience, really think that that's all about? So what would be the next potential projects? Mette already said in a previous session, we have many ideas about new projects, but what would now the priority of next projects within this domain? Ulrich?
Picking up, I do not know if I understood you right. Your question, you are asking how to bring e-mental health tools to the patients, or how to improve implementation research?
How to improve implementation research so that we bring better and more digital mental health services to patients and professionals, in my opinion, and go a bit beyond these barriers and facilitator mantra.
Well, it's like in real life. It's not very easy to learn from papers, from theoretical, from theories. The best to learn it is really how we did it here in this consortium, to try to do it and to learn from each other in a practical manner. This probably is the major achievement, that now a quite large group of young people has learned about barriers, facilitators, how to overcome them, etc., etc. This practical learning, I think this is important. And I'm not so sure that that it's easy for other people to learn directly from implementation research as much as we might hope. We learn a lot, but if other people really learn it, it's like with children, they make the same errors as the parents, and this will be the same in every generation. A little bit over pessimistic perhaps, but I think the most important is the pragmatic learning.
Okay, David, do you want to react on that?
Yeah, Mo, I was thinking about like the next research questions. And so for me, like Tim wrote, we do not need more studies on barriers and facilitators. But what I personally think is that we need more studies on experimental manipulation of barriers and facilitators. And at least in the digital mental health field. So what I think also the next step of our research group is like we now intervene like on the organizational level. So we're going down on a lower level and intervene at the patient level and really try to address the barriers and facilitators and experimentally manipulate them. And do, like we call it, like either acceptance or uptake facilitating interventions, and really then do here also like trial designs with like factorial designs, really better understanding how we really can optimize that. And I think, yeah, and there has not been done a lot in the health field, and yeah. Let's see whether we can, this way, getting more people affected in evidence-based treatments.
Yeah, it's almost a player for setting up a new project in terms of a natural laboratory where you can indeed manipulate several barriers or facilitators with organizations who have already a certain level of e-mental health implementation in their organizations ongoing. Is that the line you are thinking of?
Yeah.
Okay. Are there others? Because I want to ask Ainsley, or the ones who are the boss of this session, I thought the time is more or less over. Do we need to end?
Your time's almost out. If there's one more comment that would like to be made, then that's fine. But then we're ready to move along. Thanks.
Okay, so yeah, okay. So are there any final remarks anyone wants to make, or David or Ulrich?
No, it was a great pleasure.
No?
To
Okay.
be on board.
I would like to come. Oh, Ulrich, did I interrupt you?
No,
I would like to come back to what you said in the beginning, Heleenn. So I don't remember, was it like 7 years ago or when we started like the first ideas of this project? I don't know. So it's so long ago and it was so complex, like in so many different, like the disciplines, research methodologies, and bring these people together. And I think it's amazing what has been achieved. So irrespective like of the results, I think the learning was a lot, and I'm really looking forward, hopefully also from this like group and members, that something comes out of that also, and that this facilitates like new endeavors. Yeah.
Yeah, I remember not the year, but the setting. That was the ISRI conference in Seattle, where Christian almost dropped down from working so hard on the proposal. That's a clear image I have. I think there were many people from us at that conference. So there was also a cross-fertilization, and that speeded up the project proposal. But I fully agree with what you are saying. So thank you all. I would like to give the floor back to Ainsley. Thank you.
Thank you so much, Heleenn and Ulrich and David, also for the nice reflections and the nice words.